Hello everyone, my name is MEENU Sharma from Nursing Department, Clinical Instructor in RPIIT Medical and Technical Campus. Today I am teach about hypertension. What is hypertension? Hypertension, it is also known as high blood pressure, in which the blood pressure in the arteries is persistently elevated. The high blood pressure is 140 by 90 mm of Hg. Now, what is the causes of hypertension? First one is renal disease, second is head injuries, third one is sleep apnea, next cirrhosis of liver, next is family history, next is stress. Now, what is the sign and symptoms of hypertension? First one is headache, blurred vision, dizziness, fatigue, vomiting, chest pain and nausea. Now, what is the diagnostic evaluation of hypertension? First one is history taking. Now, ECG, CVC, complete blood counts. Now, all the medical history. Now, chest X-ray. Now, what is the management of hypertension or high blood pressure? Firstly, we change the lifestyle modification. Now, give diuretic therapy to the patient. Now, give beta blockers to the patient. Give vasodilators to the patient and give anti-anxiolytic therapy to the patient. Thanks everyone.